At present, the goats and sheep are grazing animals, and therefore they are more prone to the poisonings, and especially the plant poisonings. Parthenium is also very common in our country. Maybe on the roadside or even many grazing lands, this Parthenium is one of the dominating weed at present. And this also contains a toxic principle, that is sesquiterpene lactones. This is a photodynamic substance, primary and responsible for a primary photosensitization. You see, in a lantana camera toxicity, there is a secondary photosensitization because of hepatic damage, liver damage, there is a photosensitization. Whereas in case of Parthenium toxicity, there is a primary photosensitization because it contains the photosensitive substances, photodynamic substances, which get accumulated beneath the skin. And when that skin gets exposed to the, you can say, ultraviolet radiations, the skin cutaneous lesions may develop. So development of a dermatitis, particularly over head, face, nose, and mandibular areas, ears, and cornea. Again, this photosensitization is common in case of sheep and goat or head and face region. That is more exposed part. Intense pruritus and itching. Swelling and secondary bacterial infections may develop. If no treatment, gangrene and sloughing of the affected areas may occur. Usually the signs of Parthenium toxicity and the signs of lantana camera toxicity, they appear more or less similar, cutaneous lesions. But there is one differentiating feature, that in case of lantana camera toxicity, you will find a typical jaundice. Mucous membranes are yellow, dark yellow, urine is also there. Based on that symptom, you can very well differentiate. Again, the treatment of photosensitization, it's a symptom, and there is no specific antidote, just give the symptomatic treatment. And for every photosensitization case, we recommend antibiotics like amoxicillin, cloxacillin, maybe for 3 days to avoid the, you can say, the secondary bacterial cutaneous infections. Then antihistaminics, they are very important. They have to be given for 5 to 7 days, depending upon the recovery. So antihistaminics are very important. Then a local antiseptic sprays, they are required, or maybe antiseptic ointment, and zinc. Generally, it's a zinc is a demulcent, and that can be used. A zinc ointment can be applied, or maybe any spray can be applied. A B complex can be given. But mainly, you see, the antihistaminics and the antiseptic ointments, they are required. The next is the Ipomoea species, Ipomoea carnea. So in Marathi, in Maharashtra, we call it as a besham. This is normally not consumed by animals, but accidentally hungry animals, they can consume it, and this poisoning can sometimes develop because this particular, you can see the shrub is green. Usually this is being used for fencing, and this is found nearby water resource and all these things, and it remains green during the summer season when no greens are available like this. In that case, the animals, they are likely to consume, and in that case the poisoning will develop. The toxic principle is a resin, that is scammoniin, and this is common in goats as compared to the other ruminants. And the typical signs, they include the nausea, salivation. So nausea cannot be judged in case of the you see our ruminants, but salivation is there, and diarrhea may appear. There may be a dilatation of the you can see the pupils, incoordination, and staggering gait. So nervous signs appear, means GI signs of GI irritation, and nervous signs they may develop. And in the later stage, you may find a paralysis of the limbs and decreased reflexes. There is a cardiac failure, hypotension will develop, and finally the animals will die. In a subacute poisoning, only anemia will develop, weakness, anemia will be there, leukopenia is there, and immunosuppression is there if the animals, they continue to eat this Ipomoea on a regular basis. There is no specific treatment for it. Gastric lavage or saline purgative. Again, if there is irritation and diarrhea, we cannot go for a saline purgatives. Lavage can be tried. Then the fluid therapy is most important. In my opinion, the discontinuation of feeding and then the fluid therapy, that is sufficient in getting the recovery in animals. Then the next is the Nerium oleander poison. It's a very common, it's an ornamental shrub. It is found everywhere. It is being seen everywhere. And this contains oleandrin and nerium as toxins. And ingestion of a very small quantity, even a very small quantity, few leaves of Nerium oleander can lead to a severe toxicity and case fatality. The signs, they include the colic and diarrhea. Means signs of GI irritation they are observed. Actually, omission is not evident in case of the goats, very rarely. But colic, abdominal pain, and bloody diarrhea with a tenesmus. Tenesmus means straining, severe straining, and the colic. These are the three symptoms, important signs they are observed. Then there may be irregularity in the heartbeat, that is cardiac arrhythmia, and the nervous signs like incoordination and dizziness, tremors, convulsions, paralysis, and death. So signs of GI irritation and the nervous signs, they are found in case of Nerium oleander poisoning. So now how to treat? If there is a diarrhea, in that case, again, the use of saline purgatives is limited, and the atropine can be used in the cases that is useful. That can be used. Sedatives, if nervous signs are there, in that case, diazepam can be given. So atropine and with the diazepam and fluid therapy, in my opinion, these three things will definitely help